starting in our second speaking class. It's a first encounter, but in an emergency department. The card I have selected is basically from the nursing side, but the way you start the card, apart from the basic reading, the approach could be same in any of the setting, like maybe medicine and as well. So anyhow, the department is emergency department right now, and we need to read the history in the provided time of 2 to 3 minutes so that we can make the notes. When we read the history, we have an idea that there is a patient who is having this psychiatric condition. So before we can proceed further, you should be careful because the psychiatric condition might be challenging. Patient can give you tough time. Anyhow, so there was some problem. However, the cardiac treatment has stabilized. Uh, like she is defensive and angry. It's also important if you can read it. And she's quite concerned about this thing that there is no eating problem. So, with reference to this presenting complaint, she is also concerned that there is no problem existed. So it means that she is going to give you tough time. In the first point, the task, we can see that she is asking from you that why this drip is running, and you have to answer using the layman language. In the second task, you can see tactfully ask. So you should be very careful about the eating habit. So what we can do, you can take the permission. In here, when you go for the inquiry, you can make the patient mind like why is he having this problem, so that you can inquire some data regarding to her eating pattern. Okay, and the purpose of asking this question to allay her, like suffering, or to be the source who can drive the data from the patient, so that it can be helpful for the consultant to treat, right? And secondly, is the mental health doctor. When you use the word, patient will be angry and she's gonna give you tough time. But there is a counseling scenario that has to be done. So how would you start the card? Let's say there is an 18-year-old female. So before we can start, we can discuss the name of the patient beforehand. Like I have not started the card even. In the 2 to 3 minutes time, I can ask you how should I call you, right? So then we can start in this approach after your introduction. Let's say, hello, my name is XYZ. I'm one of the staff nurse in this emergency department. Sarah, I can see that you seem not to be comfortable. Is everything all right? Why? Because you can see that you have to assure the patient is concerned. So directly we have to start the card. It could be right approach rather than starting this way. Hello, my name is blah blah. I'm one of the blah blah person over here. I can see that you are having irregular heartbeat and from your notes, and for that reason, he was having some treatment done, and you were having suspected condition of aneurysm nervosa. For better understanding, I would like to ask more questions. Now, this approach that I just had discussed is not an appropriate approach in this emergency setting. The way we used to gather the information in the normal setting. Why is that? Because this is emergency, we have to address the patient concern immediately. So how can we start the card? I will repeat it again. Obviously, there would be, you can say, opportunity for you to learn more, and you can be more. You should not be flexible in your start, but I'm just going to give you an idea. It's not that you have to memorize these lines. There would always be a chance of improvement for you. Anyhow, so we can start the card. Hello, my name is blah and blah. I'm another nurse over in this emergency department. So, Sarah, I can see that you seem to be a bit concerned. Is everything all right? Then the patient will tell you, yeah, I'm concerned like why this drip is running. I'm quite concerned it's going to harm me somehow. So after listening to the problem, Farah, first of all, let me show you that this drip that has been running, basically the purpose of this drip is to, like control your body chemicals, the salt in your blood, as there was some deficiency. For that reason, I can see from your file that you are having irregular heartbeat. So, and we are suspecting a condition that is related to your eating pattern that has caused, irregular heartbeat. At the moment, we are suspecting. So, for that reason, in order to stabilize your condition, or they have given this drip to you. So, again, I'm gonna give you assurance that this drip is not gonna harm you by any means. Okay. So, have I made myself clear? Is there anything else that is concerned for you? Basically, after asking about the major task, you have to go for the clarity. Okay. Then you can see that there is a next question that is tactfully ask her about eating habits and food intake. So then we can lead. Okay, Sarah, as I can see that at the moment in your file, we are suspecting that you are having a medical condition that is directly related to your eating pattern. So before we can move on and make any diagnosis, we would like to document the records. So I would be asking some personal question, which includes your diet and eating pattern. So if you allow me, can I ask you those questions, please? Because you have to take the permission from the patient whenever you are asking any personal question. Then you may start the card with breaks, not like what do you eat, not a generic question. You can start, okay, let's start with your breakfast. Oh, that's great. We are eating, let's say, blah blah whatever. And how about any in between meal between the lunch and the breakfast? Okay. And what do you prefer to take in the lunch? And how about the dinner? Like that. So, Sarah, what do you think? Like, do you think that this is sufficient intake, or you have to modify your diet? What is your understanding about that? Then patient might give you tough time, like, why are you asking this question? I'm not supposed to answer you all this question. It's my personal thing. I appreciate your concern, Sarah, and let me assure you that your privacy is the topmost thing for us in any regard. Coming toward this scenario, as you can see that you are having irregular heartbeat, and after we had added this strip, it has controlled your heartbeat, and like the chemical that was, you can see there were lack of chemical just because of your eating pattern, as you just mentioned. So as soon as we have added a drip, so it has controlled your problem. So in that regard, it is quite important for me before the doctor that we say who is specialist to treat this kind of health related problem, that is, that for him it would be appropriate to know, you can see, your condition first. As you can see that this condition has direct relationship with your mental health. So this is a specialist doctor who will be there. The patient might give you tough time, like, well, I'm not supposed to see the mental doctor. To the crazy people. Then you have to show again him, to her. Let me show you that he's a specialist doctor. As you have been admitted to this condition, so it's very important for you to be seen by the specialist, as it might lead towards some life-threatening condition. So, in order to avoid, don't you think that we should be seen by the doctor who is specialist in regard? What do you think? Put the ball in the patient court then, right? In your counseling, try to be more polite, more humble, more patient focused in your card, right?